it can almost be predicted, so it's kind of funny.
I'll just tell you offline. I'm going to set up a Torn consult for you, and I'm going to block the time after because I know it's going to go over more than 30 minutes, Dr. A.
Okay.
Okay, what happened to?
He's coming back.
Okay, he's like, it's not that far from your office.
All right, let me know when everyone's ready.
Ready.
Luis, you want to test your mic real quick?
1, 2.
That sounds good. All right. Are we ready, Sarah?
Mm-hmm.
All right. Hi, everyone. Thank you so much for joining us. My name is Ryan McGee. I'm the communications manager here at WellcomeMD. And today, this webinar is going to kind of help answer probably the most common question that we get here, which is, what exactly is concierge medicine? We're going to do our best to answer that question and explain how this concept helps our patients. And here to help us with that is our membership expert in Charlotte, North Carolina, Tara Greenberg, as well as our health coach, Luis Perez, and Dr. Matthew Akampora. So now I will turn it over to Tara, who will get us started. Tara, go right ahead.
Well, thank you for the introduction, Ryan, and thank you all for taking time out of your day to join us for our webinar on concierge medicine and why it's the fastest growing segment of the healthcare market. As we've all seen our insurance premiums go up and up, doctors have seen their reimbursements go down and down. And this is basically forcing doctors to see more and more patients just to keep the lights on. Unfortunately, this means that patients have less time with their doctor and less access to their doctor. One solution for this is membership-based medicine. And in membership-based medicine, our patients opt to invest in their health by paying a membership fee. This membership fee enables us to cap the number of patients any one doctor sees and to provide a host of benefits for our patients. It means our patients get greater access to their physician, and there's a smaller doctor-to-patient ratio. In fact, many of our doctors used to see 30 to 40 patients a day in their previous practice. And at WellcomeMD, they average only 6 to 8 patient visits a day. Our practice is in South Charlotte. It's right across from the Arboretum, so it's very conveniently located. And I would like to take this time to introduce you to Dr. Matthew Akampora, who I can honestly say is one of the finest physicians I've ever had the privilege of working with. Dr. Akampora, do you mind sharing with us how you feel WellcomeMD has affected your ability to treat your patients?
Most definitely, Tara. And again, thank you for the kind words and the introduction. As the physician with WellcomeMD, especially in the environment in which I'm practicing, I'm extremely privileged and at the same time blessed to be able to be the healthcare advocate for my patients who require my services. The environment is one that is conducive and patient-centered. And again, without being too redundant, I really enjoy the fact that I'm a part of this team, and I really feel privileged. I want to take this time now to introduce our health coach, Luis Perez. Luis is, as I said, our health coach. He was voted top 100 health coaches in the United States in 2019. In addition, he has a skill set that I think, or skill sets that far exceed that of his own peers. But I think his passion outdoes his skill sets and what he does, and basically allows me to be a better physician. We work in tandem with each other and help our patients achieve the goals that they set for themselves. Luis.
Thank you. I really appreciate that introduction. Thank you very much. And as Dr. Acampora said, I really enjoy working with the patients because I get to work one-on-one with members that really have very personal and specific needs to where we can really help them grow. And so with the members, it's the being part of that wellness journey with them and using the great tools that WellcomeMD provides us has been truly a blessing to be a part of this concierge medicine.
Well, at WellcomeMD, we have the time, teams, and tools that we need to help you reach your health goals. And meeting just two of our clinical staff really gives you the idea about how we work as a team. If I wanted to address time, I want to do this very concretely for you. And looking at studies that were actually done prior to COVID-19, the wait time to get an appointment in Charlotte is estimated to be 29 days. Now, we speculate that with all the patients who had to cancel their previous appointments, rescheduling them, in a traditional practice, that wait time is going to be even longer. Here at WelcomeMD, we always reserve appointment spots for our sick patients. So sick patients can make acute care appointments same day. We also never double book any of our appointments. Another thing we traditionally see in other practices is that they may double or even triple book appointments. It's why you typically will have a 40-minute wait, and a majority of that wait time is going to be in a waiting room filled with potentially sick patients. Here you'll have little to no wait time, and you'll have quick access to your private exam room. The doctors here in Charlotte are estimated to be booked every 7 minutes for an acute visit and only 15 minutes for your annual wellness visit. Our appointment slots are a minimum of 30 minutes, and Dr. Acampora will shortly go over all that we have to offer in our 90-minute annual physicals. It's one of the things that I get feedback from patients that say that they never knew what they were missing because they've never had this experience before and how much they value it. When I talk about a team, that means that we have a comprehensive approach to your care. You'll have a true relationship with your doctor. This will include unlimited consultations with your health coach. And these visits with your health coach can either be by phone, in person, or remote. The reason why we have that flexibility is that we feel that by making these visits convenient for you, you will be more likely to utilize them and get the greatest benefit from it. And most importantly, we focus on giving you a whole person approach to healthcare. It's very holistic, preventative, and proactive, so you can reach your goals today and in the future. When I look at the better tools we have, it means that we can take a deeper dive. And I greatly appreciate it if our clinical team can go over how they utilize these tools to help our patients.
Thank you, Tara. With regards to our comprehensive advanced lab panels, I want to lead into it by saying probably one of the most important visits you'll have as a member with our practice is the first visit in and of itself. That's a 45 to 60 minute visit where we go over your medical records with you. We go over your current medical problems if you should have any, and we address them. But what we basically delve into is your past medical history, any pertinent family history that may warrant further looking into. We have a standard set of labs that we draw, but based upon what we find on that history, that relationship building that we do with our patients will gear what our customized advanced lab panels actually look like. So the thing is, if you're the type of person who has a high risk of cardiovascular disease in your family, well, we're going to concentrate on certain lipid panels that give us that information that help us treat you in the long run. Luis, would you like to comment on our DNA fitness and body composition analysis?
Yeah, absolutely. So the DNA fitness and nutrition testing is a fantastic additional tool or a guide that focuses only on the actionable. So focuses on fitness and nutrition and how our members individually will have different reactions, of course, and how it will be with things, how their body will react to things as carbohydrates, fats, and what training type should help in setting them for getting optimal results. And as well as with the in-body composition analysis, that together with those two, it gives us the whole entire picture of how progress is going overall for everyone. And that's how we make it very personal, because the in-body composition will tell us things as their metabolic rate, things like that, to where we can always make sure that what we're doing is focusing specifically on the individual.
Dr. Ait, I know that you went over the comprehensive physical when you were talking about labs. Was there anything you wanted to add how our comprehensive physical is better or different from a traditional physical?
Sure, Tara, thank you. Most physicals in doctors' offices here in Charlotte probably are anywhere between 10 and 15 minutes at the most. Our exam is 90 minutes, and when we say comprehensive, we mean comprehensive. We take a look at the various tools that are in front of us, lab results. We also do certain tests that are not normally done, such as lung functioning tests, hearing tests, eye exams, and even EKGs. So that physical does take 90 minutes, and it includes a detailed discussion with the patient. And not to beat the proverbial dead horse, it's personalized based upon what we find clinically on the exam as well as what we find on the lab work. So we're able to really enact a plan of attack for the patient when they leave our office.
So that's kind of how everything is connected together. So after the comprehensive physical, Dr. Akampora and I, we work together to make sure that we personalize your nutrition and exercise to account for what we have found. So we work together and always at the pace of the member. That is the biggest thing, is to make sure that the member feels comfortable with their overall journey, because it is their overall and individual journey. So in order for it to be a true lifestyle change, we have to enjoy the process. And that's what we really try to do, is focus on the individual and how they're progressing and make sure that they're comfortable. Things like the ups and downs will always happen. And what we try to do is help them understand why they happen and make sure that they understand that we're always by their side to help with accountability and support. So things that we do is preventative, proactive, personalized care are things like the nutrition, the exercise, sleep improvement, the stress reduction, and overall balance work. Because when we look at all of these things, we need to remember that everything's connected. So we have to make sure if there's lack in the sleep, that will cause stress problems, which will hurt our nutrition. So we look at all those things and work them one by one with actionable steps to make them behavioral change, and focus on those things to help the member improve with time.
Well, thank you both for that. So I wanted to go over some of the most valued membership amenities, and I wanted to start with the 24/7, 365 access to the physician. And this is very important because this isn't to a nurse or a nurse practitioner. This will be to a WellcomeMD doctor who has access to your medical records, your medical history, and if it's your own WellcomeMD doctor, which will be 90% of the time, somebody you have a true relationship with. We also have those same day appointments when our patients are sick. It's something they very much appreciate. And perhaps what they appreciate even more is those appointments are going to be with little to no wait time. And being able to come in and not be exposed to a waiting room full of sick people has become more and more important in the time of COVID-19. Dr. Alcampora already went through some of the differences in our 90-minute annual physical. And I have to say, it's quite often we get feedback from patients who say that they didn't know what they were missing because they've never had the experience before. It's a way for us to really do a deeper dive and to get on top of problems, because if we identify a problem when it's small, it's going to be much more manageable to treat and our patients will have significantly better outcomes. Another thing I hadn't mentioned previously is that we have house calls and local hospital visits when appropriate. And one of the things about the hospital visits is that it's a way for our doctors to be your true advocate. This is also true with our physician liaison, with their specialist providers. You always want to make sure the right hand knows what the left hand is doing, and our doctor functions as the brain to provide continuity of care and coordination of care. Our telemedicine appointments have become increasingly popular, and I think in the future we're going to find that this is a tool very much appreciated by our patients, and we have an in-office lab for your convenience. Our courtesy visits for out-of-town guests for acute care needs can be especially important. Say your parents are in from out of town and one of them gets sick, it means you don't have to take them to an urgent care clinic. You can make an appointment where they can be seen by a doctor you know and trust. And the annual patient portfolios allow our patients to track their progress. The wellness program benefits which are most appreciated are the DNA test for fitness and nutrition assessment. And that's going to look at actionable genes. For instance, when Luis is looking at a meal plan and nutrition needs you may have, he'll have the tools to know how you specifically have a DNA predisposition to process carbohydrates or proteins or fats. So that program he comes up with is going to be very individualized based on science. He does the same with the in-body composition analysis, the individualized diet and fitness programs, and we have monthly events hosted by our own health team and our partners in the community to give you the latest benefits in the world of medicine and wellness. So we've specifically designed this program so that you can ask your questions and we'll provide the answers, and we're going to ask Ryan to facilitate that for us.
Absolutely. Thank you, Tara. The easiest way to ask questions if you're watching us via Zoom is you'll see a box that says Q&A, and that's where you can go and submit your questions. We've already got one, and it's one that we get a lot. Tara, why is the logo a pineapple?
That's a great, I love that question. So if you look at our name, WellnessMD, with the two L's, we have the health component of it. The welcome component, which is tied to the pineapple, is because the pineapple is a universal symbol for hospitality, wellness, and friendship. So it kind of hits the two things that we really focus on. One is being relationship driven, and the other one is the wellness component. So thank you. I love that question.
Another question here. How would someone with autoimmune issues benefit from having greater access to the doctor or from concierge medicine in general?
I'll be more than happy to answer that. I think because of the fact that you need a captain of the ship. So the thing is, when someone has autoimmune diseases, they may be multiple. And as Tara eloquently pointed out, the right hand sometimes doesn't know what the left hand is doing. So the thing is, quarterbacks win championships. I think that's what people need who have these types of illnesses that require multiple subspecialists. So the thing is, you need someone who's going to navigate you through those times that you're going to need some assistance. And plus, you may not be able to get in contact with your subspecialist. So if you're seeing a rheumatologist is a trained internist who specializes in rheumatology. So the thing is, the internist, him or herself, should be able to help you with any problems if you could not get in touch with your subspecialist.
And again, you can submit your questions through the Q&A box. We have one attendee who would like to ask the question themselves. So Clint, go ahead.
He's muted.
Yeah, Clint, you'll need to unmute yourself in order to ask your question. All right, we'll move on. What kind of tools do the physicians and our health coach, Luis, have to deal with stress and sleep? I know that I've heard Dr. Akampora talk about this a lot, that those are two of the major pillars for overall health. What tools do we have to help patients deal with stress and sleep?
Well, sleep hygiene is very, very important. So I think going to bed at the same hour each night, trying to get at least 7 to 8 hours of good sleep is definitely warranted. Making sure the area that you sleep in is clear and clean and well ventilated and not too warm. And making sure that the mattress in and of itself that you're laying on is actually very, very comfortable. They do have a lot of these Tempur-Pedic type mattresses that exist that have proven to help people with regards to sleeping issues. I also feel that in terms of stress, that what I tell my patients is that you have to really step outside of that circle of stress that you're in to look at yourself in that stressful situation, and maybe do something that is just solely for you and not anyone else. You may want to read a book, or you may want to take a walk around your neighborhood. You may want to engage in yoga. And these are all things that you do for yourself that will definitely release stress. And exercise is certainly a great way of doing it. And you're essentially killing two birds with one stone with regards to exercise and diet and nutrition, along with reducing stress.
And also another thing, one of the greatest tools we have is also that DNA test, because that actually does focus on the individual's specific response to stress and the sleep as well. So it's, again, even more detailed personalization with that DNA test as well.
All right. Next question. How quickly can someone schedule their first appointment once they become a patient with WellcomeMD?
So that kind of touches on the whole process. So our whole process is really set up to be convenient and to meet your needs quickly. If somebody wanted to become a member, they could do that literally within 20 minutes, 30 minutes. It can even be done remotely through eDocs. Once that person is joined, I register them as a patient, enabling them to make an appointment. And if it's an acute appointment, a true sick appointment, it can be made that day. I then send you the forms for your medical history and your medical records, and we want you to get those back in the office as soon as possible. Now, if it is not a sick appointment, ideally, we'd like to get your medical records in the office before the appointment, because our doctors are going to review those records, find out your history, and be able to treat you more comprehensively. And that may be partially based on how quickly you get the papers back to us and how quickly your other doctor's office returns the papers. But Louis, what would you say the average turnaround time we have for a non-acute visit? Because like I said, that sick visit can often be made same day. But for a non-acute visit, how long does it take that you're usually scheduling our patients out?
I mean, we can do it as easy as next day, honestly.
Okay.
Yes, we've had patients, Tara, that you registered in the morning who we've seen in the afternoon.
Right.
Because they wanted to establish themselves. And it was even for non-acute situations, but we pretty much operate on the same day, next day, type service that you alluded to before.
Well, and I think that's unique because you all tend to be a lot more flexible and not as rigid as some other doctors. Ideally, we want all that paperwork back, but the fact that you're willing to work around that just shows your commitment to our patients. So we're very fortunate with that here in Charlotte.
All right. I believe that's all the questions we have. Tara, Luis, Dr. A, thank you. And do you have any parting thoughts before we get out, any of the three of you?
Well, I would just like to thank you all for taking time to communicate with us today. If anybody has any other questions, I will make myself available. One of the things that we like to do to thank you for taking time to register with us today is that we do provide a discount to webinar participants. That's just a standard thing that we do. And I would be the contact person to answer any non-clinical questions. And if you have a clinical question, I will refer it back to the appropriate team member to get an answer for you.
Absolutely.
All right. Thank you all so much for joining us, and we will talk to you again real soon. Thank you.
Thank you.